Hi everyone. I was chatting with a friend of mine who has a back injury like myself a while ago, and he suggested that maybe I should do a video log, just a video to share with people where I talk about some of the issues involved with living with a long-term injury or chronic pain, which I know a lot of people suffer from. As far as I know, doctors say that lower back pain is the commonest reason for anyone to be at the doctor's. So I'm sure I'm not the only one suffering from lower back pain, so I'm sure a number of you could sort of benefit from whatever insights I've had regarding this matter over a number of years. And it's not just back pain. I have a number of friends with other injuries. Very often it's parts of our body that have to deal with impact rather, like the knees, the back, certainly the elderly, but even my generation and the young, because we tend to lead sedentary lifestyles these days, and it that has its own set of problems, particularly with sitting and chairs. But in any case, just to give you a little background, I myself have a back and related knee problem. Just a second. And what happened is that about 8 years ago I had an ACL tear. That is, I tore my anterior cruciate ligament in my knee. It's the ligament that stabilizes the joint, prevents it from rotating. And I know a number of other people who are into sports who have had this. It's a frequent injury in sports. And I had an arthroscopic ACL reconstruction using quadrupled semitan graft with some kind of tape and endo button for fixation. So essentially I've got this little I don't know if you can see it, but I've got and forgive me if this is gross, but I've got like a metal bolt inside my leg which is going to stay there, so I'm basically an android. In any case, like, the surgery was fine. It went off well, and I recovered strength to some extent in my knee, and so medically speaking, there isn't a lot wrong with my knee per se. But what happened is that following the injury, and this is my main advice to anyone, please take this very, very seriously. If you have suffered from an injury, if you've needed surgery for it, do exactly what the doctor says and what the physiotherapist says in the post-operation phase, in the recovery from injury, because if you don't, you could get stuck in a situation like me, and it's really a horror story. It's really because of 2 years of negligence. I just let things slide, and now my body has become set in a certain kind of pattern, which is extremely hard to break, and I can't tell you how much I suffer for it. Other doctors I've seen have mentioned that partly some of it is genetic because of my anatomy and posture and such. I would have had back pain anyway, but mainly I think it's from my own negligence after my surgery. So essentially what happened is that I had an ACL reconstruction, and then I just chilled. For 2 years I led a very sedentary lifestyle. I was in JNU at the time and just sort of not doing very much, which is unusual given my own sort of history, because I've always been, or not always, but at least since the age of maybe 14, 15, played a lot of sports and been physically active. But for these 2 years following my surgery, I wasn't. And what happened is that a certain disbalance set into my muscles, leading to lower back pain and later discomfort in the knee, which when I went to the NHS while I was studying in the UK, the doctors and physiotherapists found that I am displaying significant muscle imbalance with overactive erector spinae and latissimus dorsi and weak glutes. I also display a positive Trendelenburg on the left, don't know what that is, and have reduced quads and hamstring strength on the left, while I display mild discomfort around L5. On the other hand, there was no lumbar stiffness. And anyway, this physiotherapist gave me some targeted exercise, which did help for a while. For about 4 or 5 months I did improve, but it's sort of a back and forth process. There are a lot of changes and I'm never 100%. I'm living in sort of near constant, I won't call it bad pain, but it's sort of like a niggling pain, which is the most annoying thing about it, and it affects me pretty much irrespective of what I'm doing. It limits what I can do. I can't run. It usually triggers this really bad pain inside my hips, which has me sort of out on my back for days. I can walk, but sort of after doing a lot of stretching, can't really walk long distances. What I can do is swim and cycle with a little bit of discomfort actually in the knees, but that's pretty much the only cardio I can do. But despite that, I've sort of tried to stay fit, which is something I'll talk about. But even sitting down can be uncomfortable. I have to sit in this funny kind of man-spready way, which is quite obscene, I suppose, but it is what it is. Which is another thing that I'll talk about. And sometimes even when I'm lying down, it can be uncomfortable. So anyway, that's enough about me whining about my back. I wanted to make this as general as possible, but also take off from personal space. So I've told you what my issue is. I'm essentially dealing with daily pain that sort of bothers me in a number of ways, and I'm sure there are analogs to this in other people's lives, even if it's not the exact same thing. So I just wanted to sort of make really, like, I have it jotted down here. I wanted to make about 4 points about living with chronic pain. And the first is that manage it. Okay, so number one is that medical science has progressed a great deal. We don't live in medieval times anymore. There are doctors, there are physiotherapists, there are medicines, there's surgical interventions. There are a number of things that can help you. As regards to surgery, be very, very cautious. I don't want to blame the surgeon. Dr. Ronan Roy was a very good surgeon, and he did his job on my knee. I couldn't really not have had the surgery because I had a near complete tear of my ACL. But usually the non-surgical option would be the best, because the surgery is a very big deal, and not to mention expensive. So manage it is point number one. Do whatever it takes to live with it. In that, if you have the kind of pain that I have, which takes about half an hour to 40 minutes of physiotherapy every day, do it. Even if it takes time, even if it takes away from other things, simply because not doing it will mean that your quality of life for the rest of the day is just going to slip, right? And besides, this time can actually be used productively. You can think of it as a kind of space to meditate or just think about things. In my line of work, I'm a PhD student in English literature. There's a lot of books that we need to read, and I have many of them as audiobooks. So what I'll do is, while I'm doing these exercises, I will often have something playing in the background, so I'm listening. Or I listen to some music, things that make me relax. But in any case, it's not a terrible thing if you need to take about 45 minutes in a day off to manage your pain. And it's rarely more than that. Even in quite severe sort of situations like mine, it may be 20 minutes in the morning, 20 minutes in the evening, whatever it is. Just do what it takes to mitigate it, to reduce it to whatever extent possible, right? That's number one. The second point is sort of the less simple one, really. I wanted to say that don't let your disability or your pain, your situation, don't let it stop you from leading a quote-unquote normal life, right? For some people, I understand that it may not be at all possible, but many people might be in a situation like mine where it's largely up to you to decide how much you're going to push yourself. It's up to you whether you want to lead a very full, very active life, feeling pain, no doubt, suffering from more pain because of it, or sort of chill a little bit, not engage in so many things. But so for many people, it's not an excruciating pain, or it's something that you can be almost normal with, albeit suffering through that process of leading a normal life.